A number of U.S. Democrats come under attack over their support for the newly passed health care bill, while Republicans still challenge the whole issue. Can Barack Obama sell the bill to all Americans after he's signed it into law? And how will it play out for Obama's presidency as a whole and the upcoming midterm election? This is Inside Story. Hello and welcome to the program. I'm Imran Garda. It seems like the debate on the American healthcare reform is far from over, as Congress is forced to vote again on the bill. Well, after a year-long struggle, US President Barack Obama managed to gather enough support for it in the House just earlier this week. Well, on Tuesday, he signed the historic $938 billion health overhaul that guarantees coverage for 32 million uninsured Americans. While the reforms were signed into law, its amendments are still to be finalized. And now Republicans who strongly oppose the reforms are using a technicality to delay the bill. Meanwhile, some Democrats who supported the bill are having a hard time. They've been subjected to vandalism and death threats. The FBI has been called in to investigate. Well, the reforms will be implemented in several phases over the coming years. In a nutshell, it intends to make insurance affordable and encourage Americans to opt for coverage. And to that effect, within a year, small businesses providing coverage to their employees will receive tax credits. And by 2014, people without insurance will be fined. It also intends to regulate the health insurance companies. They'll no longer be able to deny children with pre-existing conditions. It will bar insurers from cancelling policies except for fraud. Also, companies will not be allowed to have lifetime coverage limits. Well, joining us to talk more about this in Washington, D.C., Phil Kerpen is the Vice President of Americans for Prosperity. Oliver Fine is with us from Louisville, Kentucky. He's President of Physicians for a National Health Program and is also Professor of Clinical Public Health at Cornell University. And in Paris, Victor Rodwin. He's a Professor of Health Policy and Management at New York University. Gentlemen, thank you, all of you, for joining us. Mr. Fine, if I could start with you. We've seen death threats, racial threats, vandalism. It's getting a bit ugly, isn't it? Yes, and really a very regrettable illustration of, I think, extremist politics in the United States. You say extremist politics. Do you believe Republicans and their high-profile supporters may be stoking the fire? I think it's possible that that's happening. I wish that they would actually denounce some of these falsehoods, and certainly the kind of behavior that has been going on with respect to demagoguing the Democrats. Phil Kerpen, what do you think about that? On the other hand... Sorry to interrupt you, Mr. Fine. If we could get Phil Kerpen in, we'll come back to you.
Well, I think it's very unfortunate any time people resort to violence, and clearly that's not something that should be tolerated within our political discourse. It's not appropriate. And, I think we need to learn a lot more about these incidents. I don't know exactly what complaints these people have or whether they're attacking this legislation from the left or the right, as it has many critics on both sides, as it deservedly so in my view. And so I think we shouldn't jump to any conclusions about what perspective someone might be coming from when he acts inappropriately and vandalizes property or makes inappropriate threats and so forth. But we absolutely should fully investigate that and prosecute it to the extent that there are criminal activities going on. But when you have conservative talk show host Glenn Beck saying things like those Democrats who supported the bill will be remembered as, quote, enemies of the Republic, it's ridiculous, isn't it? It's sort of Star Wars terminology, isn't it? Well, I mean, I think that the character of this country dramatically changed with the president signing this bill on Tuesday. The government is now taking responsibility for our health care. There's a much larger, more intrusive government as a result that has a different relationship with the people. To the extent that that's the case, I don't think it's an exaggeration to say that this was a major historic change. And if people don't like that, if they like our more traditional, more market-based, more individualistic system that we've had in America, then I can understand why they would see this as a very negative thing. The point here, though, is that the retribution should be taken out within the legitimate democratic process at the polls in November. People should exercise their right to vote. They should have a right to speak out in the run-up to those elections, of course, but they shouldn't behave inappropriately or act violently. And I'm pretty sure Glenn would agree with that as well.
Victor Rodwin, Phil Kerpen says this is an intrusive government and basically this is a bad idea. What do you think?
I think that he must be living on a different planet than I. I don't see in what respect our government is intrusive with respect to health care with the passage of this bill. We've had a rather active government in health care long before the passage of this bill. Thank God for most of Americans. The medical profession and people of a conservative bent have resisted all efforts to improve access to health care services. And I think fundamentally it's a moral question. We come out differently with respect to those moral grounds.
Ironically, we hear an ambulance in the background there as you talk. Let's get a response
that's an
from...
ambulance in Paris.
Yes, ambulance in Paris. Interesting, before we actually go back to Phil Kerpen, there have been comparisons between France and the United States. Michael Moore, very famously in his film Sicko, showed his view of the differences between France and the United States. He was far more enamored by the French healthcare system. He didn't like the US healthcare system. I mean, in your opinion, how big is the divide between the current US healthcare system and the French one?
I believe that Michael Moore is more of a comedian and more of an artist than he is a policy analyst, and he got a number of things wrong in the film. On the other hand, the big points he got right. His critique was largely aimed at the sector of Americans who do not have insurance or who have individual coverage, not so much the employer-based system, which covers 55% of the population. And in that respect, he was right, and that's precisely what's been fixed up, or what presumably will be fixed up if this law is implemented. Well, once it becomes a law, it's still a bill, actually.
Phil Kerpen, Mr. Rodwin said he thought you're living on another planet. What's your response? Because he says there can only be good that can come out of this, surely.
Well, I think that in a certain sense on this, Europe, where he is a world apart from the United States, and I think that most Americans are comfortable with that, and they don't want us to be more like Europe in this regard, and that's why we see some 60 or 65% of people opposed to this new law. And I think that if we do follow the rest of the world with respect to much tighter government control over the medical sector, I'm concerned that we will lose the innovation and the research and development and the drive for new cures, new procedures, new medical devices. All of these are regulated, taxed, strictly controlled under this new regime. I think to a certain extent, the rest of the world has been free riding off of the innovation that occurs as a result of access to the U.S. market. I'm worried that with a more bureaucratized U.S. system, the entire world will suffer with less research and development, less innovation, and fewer cures. And I think that's a big price to pay for trying to provide access to people, especially when you consider that this law is passed, still leaves 22 million people uninsured at the end of 10 years, according to the Congressional Budget Office, puts 15 million people on the Medicaid rolls, which is a substandard welfare program for lower income folks. The number of people who actually get access to higher quality care under this is very limited, and it's a result of mandates that actually force people to spend their own money.
Really interesting point you make,
to spend.
Because I'm presuming that both you and Mr. Fine are on completely different sides of the fence. However, that might be a point where you both agree, rather. Oliver Fine, from all I've read of your work, I think you feel this hasn't gone far enough, has it?
That's absolutely correct. You know, what I think this law represents is a bailout of the private health insurance industry. Rather than being a law that gets government more involved in health care, what it does is really transfer major amounts of government tax money to private health insurance companies. And so what we will see actually is all of the problems with private health insurance. And if you talk about bureaucracy, that is an enormous bureaucracy that every patient who has a health problem knows they've had to deal with. in terms of denials of care, in terms of the kinds of things that private health insurance limits people to. A network of doctors, usually a network of hospitals. They have to pay extra to get outside of those networks. What we need is actually a program that's more like a Medicare for All program, a program in which people would have, automatic enrollment, not paying premiums for care. Premiums are totally unfair. The president of the company pays the same premium as the secretary in the company, and one in which there would be a reduction of the kind of overhead and bureaucracy that private health insurance imposes on us as physicians and on patients.
Victor Rodwin, one of the points
Perhaps
Mr. Fine made, one of the points he made is still, okay, fine, go ahead, and then we can flesh it out. Go ahead.
Yes, I'll go back to your question on France, because I certainly agree in principle with Dr. Fine in the benefits of extending Medicare for all. I don't see the rationale for excluding people under 65. I don't see the rationale for covering one solitary organ, the kidney, and not covering other organs. I certainly agree with him that it should be extended to the entire population. The French system, in contrast to what Phil Kerpen has suggested generally about every other system in Europe, is not really a government-run system. There's so much misinformation about this and so much lying by the Republican Party on this matter that it's gotten to the point that I cannot help taking a rather strong position. The French national health insurance system is a Medicare for all system, which is publicly financed, to be sure, just as our Medicare and Medicaid program are. But the delivery is largely private when it comes to ambulatory care, fee-for-practice medicine. There's a large number of public hospitals, but there's the largest private for-profit commercial sector in all of Europe. So in many respects, the French system is a model. It also comes out much better on a number of indicators. But I think what we're talking here, and we should focus the discussion, is on the question of access to health care. I didn't know we were going to talk about medical innovation, and I'm not sure how the extension of coverage to a larger number of Americans is going to destroy the pharmaceutical industry and the medical innovation that we've had in the United States for many years. That point eludes me.
Yeah, so let's pose that to Phil Kerpen. Phil Kerpen, that's a really good point from Mr. Rodwin, and part of the challenge in explaining this to a global audience, many people will be asking, how can you have a problem with 32 million uninsured Americans, currently uninsured Americans, getting health insurance? How can you have a problem with insurance companies being prevented from dropping people when they get sick? How on earth can you oppose this?
Well, I think that there are solutions to these problems that are very different from the ones that have been enacted in this current law. And I can agree that those are problems without agreeing with the particular solutions that have been proposed. For instance, the Medicare program is $36 trillion in unfunded liability. It's a program that we cannot afford on its current trajectory, let alone to try to add more people to. This bill contemplates the creation of many vast new bureaucracies, over 100 new boards, commissions, and agencies that will exercise control, oversight over doctors and patients and all aspects of the healthcare system. We will now have a bureaucratic overlay on top of all of the existing problems that we have now.
Do you believe it's socialism?
We're trying to make a commitment. Excuse me?
Let me interrupt you just one moment, otherwise we're going to go on to too many topics.
Okay,
let's just take the problem of bureaucratic overlay. All right, there's no society in the world that has more bureaucratic overlay and control over physician decision-making than the United States private health insurance companies, and I think Dr. Fine can attest to that fact.
And those companies are given $200 billion in subsidies. They're given millions of new customers who are forced by law to buy their products. This bill was designed for them and largely benefits them. If the problem is too much insurance company bureaucracy, you don't force people to buy their policies and subsidize them while adding a new layer of government bureaucracy on top. We need to move more in a direction of patients having control of their own healthcare dollars. That's what real reform would do. Move away from the employer-based system, move away from third-party payment. Don't Don't substitute government or layer new government bureaucracy on top of insurance company bureaucracy. Get back to more like a pre-World War II style fee-for-service system. We have high deductible plans only for catastrophic situations. Get a real marketplace with transparent pricing, and we'll have a properly functioning market that will provide services in an efficient way, the same as we have in all the other sectors of the economy. We've learned that central economic planning doesn't work anywhere it's been tried. I don't understand why we would try to move in that direction, or this crazy hybrid where we're subsidizing private companies and private shareholders with tax dollars while we're layering on top new bureaucracies. I don't think that's the model for reform.
You made your point. I want to bring in Oliver Fine because he's bracing himself to come in there.
Right. Well, you know, we would certainly agree that having a mandate to buy a defective product like private health insurance is a problem. But to move to a pre-World War II kind of healthcare market in the United States is absolutely absurd in terms of really trying to deal with problems that people have with access to care. What we really need to talk about again is expanding a government finance program like Medicare to the rest of the population.
It's already $37 trillion
really,
in unfunded
again,
liability.
I think if you look at the popular press in terms of surveys and polls that have been done, you'll find that that's really what people want. Certainly, about 2/3 of Americans say they would prefer to have a Medicare-like system funded by taxpayers.
Mr. Fine,
that gives them the choice.
Mr. Fine, that's interesting that you say that.
Now.
Mr. Fine, it's interesting that you say that because you mentioned polls. The fact that it was so close when it went to a vote, passed by 219 votes to 212, and the fact that recent polls suggest, they still suggest, that this healthcare bill is still more unpopular than popular amongst American people. Is that going to hamper the president in the implementation of it? However much you disagree with the fact that it hasn't gone as far as you would have liked it to go?
Well, I mean, I think, again, you talk about it hampering the president's ability to implement. The thing that could really hamper that is what has hampered getting to a Medicare for All system, and that's namely the private health insurance industry. As you know, they spent close to $100 million per week to try to defeat this legislation and to take out,
they supported
for instance,
this bill throughout.
any
This is
form
their
of
bill. They wrote
public option. Yeah, they fundamentally wrote this bill, but it's one that they got every part of it that had any public funding, public component to it removed.
Victor Rodman, what do you think of that? Is this still a case of big business fundamentally exploiting the poor and weak in the form of those insurance companies?
I think this is the United States of America, and we're not about to take over the private insurance industry. As much as I would enjoy a Medicare for All program and support Dr. Fine and Physicians for a National Health program, I think we're having difficulty enough just covering 30 million in uninsured, and having people like Mr. Kerpen agree that that's a good thing. His notion of going back to a pre-World War II day when the markets would allocate resources based on perfect information seems to something out of the textbooks and has nothing to do with reality. We've been struggling in this country for the larger part of the 20th century to extend coverage to Americans and bring the United States up to the level of the rest of the developed world. This is a historic piece of legislation, whatever its imperfections. We've had nothing as great as this since the signing of Medicare by Lyndon Johnson, which was opposed for all the same reasons that Mr. Kerpen has pointed to, fiscal lack of control. But over time, Medicare unquestionably improved access to services. And if this bill is implemented, and that's the real catch here because it's complicated, but if it is implemented, more people will be covered, and this will begin to turn back what we've seen since the days of Ronald Reagan and George Bush, on the dismantling of the welfare state.
Right.
One of the least examined aspects of this bill is the last-minute attempt to deal with the financing by increasing the Medicare tax and applying that tax to interest payments. That's the beginning of bringing a little bit of greater equality to the United States. Now, this is a question of values. Either you believe we should have a slightly more egalitarian society than what we've had over the years of George Bush, or you believe that we should continue, for reasons which I don't believe are morally sound, but that's strictly a moral value, to increase the gap between the rich and the poor.
Right.
That is one of the greatest problems in the United States, and finally, President Obama has made his mark. Yes. I believe this is a historic piece of legislation, and should be commended for that reason.
Phil Kerpen, bearing in mind that those midterm elections are coming up. Sorry, Mr. Fine, I'll give you the final word because we are running out of time. But first, I want to go to Phil Kerpen. Phil, bearing in mind that those midterm elections are coming up, are you still going to keep fighting the Democrats over this?
Well, look, the answer is yes. Medicare's $37 trillion in unfunded liability. That's hardly a model that we should expand. Welfare reform of the 1990s is widely seen as a huge success. I agree that this bill is welfare reform in reverse. I believe, as most Americans believe, that that is not a good thing. And I also believe that the central value question is right. Do we want to have a leveling impulse? Do we want to pull the rich down to the same level as everyone else? Do we want to put equality ahead of prosperity? I would suggest no, that a rising tide lifts all boats, as John F. Kennedy said, and that we need to have economic growth. We need to put people back to work. That's the real solution to our problems right now. That's where our priorities should lie. And all of the vast new tax hikes in this bill, including the new capital gains and dividend tax hike that is supposedly a Medicare tax but will be immediately rated for these new programs, is the worst thing you could do for prosperity, and that hurts everyone's, because you tax employers, you get fewer jobs.
Okay. Oliver Fine, there's about a minute left on the program. I'm going to give you the final word.
So let me say that I agree with Dr. Rodwin that it makes a lot of sense that we have here a piece of legislation that does lead to less income inequality in the United States, and it's probably the most significant piece of legislation to do that since 1965. But I think the real problem is that it is not, like Medicare, a federal guarantee to health insurance. And that's really what we should be working for, is some way in which people can get into the Medicare program and have a universal coverage program for all Americans, not one that really leaves out, 23 million people.
It's an ambitious plan, Mr. Fine. Gentlemen, we've reached the end of the program. Thank you very much, all of you, for joining us. Phil Kerpen, Oliver Fine, and Victor Rodwin. It was educational and fascinating speaking to all three of you.
Thank you.
Well, thank you for having us.
And thank you so much, the viewer, for joining us here on this episode of Inside Story. As always, we welcome your comments, your suggestions, or your questions. You can email them to us at insidestory@aljazeera.net. Bye-bye.